Hello everyone. So basically in this video today I am going to discuss about the difference between the Conus medularis and the Cauda equina syndrome. So the first is about presentation. So in Conus medularis the presentation of the disease is sudden and bilateral, whether in Cauda equina syndrome it is gradual and present only unilateral. So remember, here it is bilateral and here it is unilateral. Now we talk about the reflexes. So knee jerk are preserved, but the ankle jerk are affected in the conus medularis, and in the Cauda equina both ankle and knee jerk are affected. Radicular pain, so it is less severe, but the low back pain is more in the conus medularis. Comparison to that, in Cauda equina the radicular pain is more severe, but the low back pain is less, because in the conus medularis T10 to T12 and S1 S5 affected, but in the Cauda equina the L2 and the lumbosacral region are affected, so the low back pain is less in Cauda equina. Now we talk about the sensory symptoms and sign. So numbness tend to be more localized to perianal area, which is symmetrical and bilateral, and sensory dissociation occurs. In Cauda equina, numbness tends to be more localized to the saddle area. Here perianal area, but here saddle area. It is asymmetrical, maybe unilateral, no sensory dissociations, and loss of sensation in specific dermatomes in the lower extremity with numbness and paraesthesia. Possible numbness in pubic area, including glans penis in the male and the clitoris in the female. So this is the difference. In sensory symptoms, conus medularis have numbness more localized to perianal, symmetrical and bilateral with the sensory dissociation. But in Cauda equina, it is unilateral, most common, more localized at saddle area and no sensory dissociation. Now the motor strength. Sensory is over, motor strength. So typically symmetric, hyperreflexic, distal paresis type of picture in lower limb that is less marked, and fasciculation may be present. In Cauda equina, it is asymmetric, areflexic, paraplegia more marked, and fasciculation are rare and atrophy is more common. Now the importance. So importance is frequent in the conus medularis and the less frequent in the Cauda equina. But erectile dysfunction in male, the inability to have erection, inability to maintain the erection, and lack of sensation in pubic area, which include glans penis in male and the clitoris in female, and unable to ejaculate in the men. So the erectile dysfunctions and the pubic area sensation are more affected in the Cauda equina syndrome. Now the sphincter dysfunction, so urinary retention and atonic anal sphincter cause overflow urinary incontinence, and the bowel incontinence tend to present early in course of the disease. But in the Cauda equina syndrome, the urinary retention tends to present late but in course of disease. Here it present early in the course of disease, but urinary retention is occur, but it is late in course of the disease. So these are the difference between the conus medularis syndrome and the Cauda equina syndrome. Thank you.